Xanthelasma. It is possible that xanthelasma is an indication of high blood lipid levels, and it has a high risk of ischemic heart disease, may be associated with impossible early death. It is a yellowish plaque that forms on the surface of the blood vessels, usually in the upper part of a blood vessel. Deposits vary from soft, hard or calcareous, although variability is usually due to the chronicity of the plaque. Xanthelasma, also known as Xanthelasma palpebra, is born as a well-defined, flat, slightly elevated yellowish growth that typically occurs on the eyelids. Although there is usually no clear clinical diagnosis, small studies have suggested that xanthelasma can even be the result of a combination of factors, such as high cholesterol, high blood pressure and high blood cholesterol. About half of patients with xanthelasma have elevated lipid levels, which are often associated with or inherited from xanthelasma. Cholesterol levels are normal, but the cholesterol deposits that accumulate under the skin increase the likelihood of yellowish growth. Xanthelasma causes. Doctors believe xanthelasma occurs in people with high blood pressure, diabetes, high cholesterol and other health problems. Dr. Robert Reed, an assistant professor of dermatology at the University of Michigan Medical School, says these growths are essentially areas of the skin where cholesterol has accumulated and concentrated. When this happens, cholesterol can enter the skin in these areas and form increased patches. Xanthelasma can cause a sharply defined yellowish accumulation of skin impurities, often covered with red, yellow or greenish-brown growths. This may mean that a person who has one or more of these lesions on the skin, as researchers from the University of Copenhagen report in the BMJ, British Medical Journal, is at a higher risk of developing heart disease and heart attack than people without the condition. It is neither painful nor harmful, as it can be easily removed with Xanthelasma remover, but if left alone, it can develop contractions, ectropions and eyelid deformities. However, if the lesions are large, a direct closure can be difficult and disfigure the face, eyes and other parts of the body such as the nose and ears. You need to treat xanthelasma before they get out of hand and they start to deform the actual eyelid, impeding on your vision. Cholesterol spots can alter the shape of your eyelid. Some people may also experience contractions of the eyelids, such as those that have occurred in the face, nose, ears, eyes and other parts of the body. Eyebrow contractions and ectropions as well as eyelid malformations can occur as a result of xanthelasma, especially in young children. Xanthelasma is a benign eyelid formation that occurs when a small layer of skin, such as the outer layer of the eyelids, is removed. In 25 to 30% of cases, the larger plaques solidify and cause excess pressure around the eye socket. Although very rare, when they reach such magnitude, then surgical intervention is an option for the medical community to consider. This is not recommended though, as grafted skin on mobile tissue can easily become wrinkle-free. Xanthelasma removal cream. Xanthelasma can be found on the outer layer of the eyelids and can affect the aesthetic appearance of your face and under the eyes. These need to be treated with xanthel to offset any further issues that could arise if the xanthelasma are left to their own devices. If you notice a yellow spot forming under your eyes, this is a warning sign for your health. Xanthelasma itself does not pose a risk to the eyes, but may indicate possible problems with liver or pancreatic function, and further treatment is recommended. In some patients, xanthelasma is so severe that it produces an unsightly appearance that is difficult to hide with makeup. As a result, patients hide behind glasses and have low self-esteem, depression and social isolation. Treatment tends to work well against most size and variants of external xanthelasma, with many in the medical community recommending the ease of use associated with a treatment with xanthel. Find out more at xanthel.com or xanthelasmatreatment.com.